Hello, everyone. Greetings of the day. And first and foremost, let me first thanks Professor Robin, Chatham House, and One Health Poultry Hub for giving me this opportunity to interact with such a big audience across the globe, to discuss with them or interact with this audience about this important aspect of antimicrobial resistance. Next slide, please. As we have known from our previous presentation that antimicrobial resistance is a silent pandemic, but it goes unnoticed by majority of the population. Here I would like to again stress, though everybody is aware, that one of the very important drivers of antimicrobial resistance is overuse or inappropriate use of antibiotics. And it is the total volume of antibiotics which put pressure on the selection pressure on microbes. If we are exposing microbes to again and again to this antibiotics or antimicrobial agents, the susceptible microbes, they get killed, and the resistant microbes, they grow and multiply. And that is the reason how this AMR is increasing so rapidly, because we are using huge amount of antibiotics. And these antibiotics are not only used in human sector, as it is shown in this simplified figures, but also in animal sector. And we all are aware where all it can be used in animal sector and also in the environment. Directly or indirectly, antibiotic and antibiotic resistant genes are present in the environment. And another important factor which leads to a huge amount of antibiotics in water bodies and in environment is the pharma effluent, because intentionally or unintentionally, antibiotics are released from pharma effluent to the environment. So there is a very intricate mesh of connectivity between human, animal, and the environmental sector. Now, finding out that which particular sector is more important and how much contribution each sector is playing is very, very difficult, because it is not easy. And it will depend upon the various regions where these things are. But we definitely know that all these three sectors act as reservoir for antibiotics and antibiotic resistant gene, and are very, very important. We cannot tackle AMR just by addressing human side or animal side or environmental side. So what we call these days, or the buzzword these days, is One Health approach. This is a term which is very frequently used these days, but unfortunately not very clearly defined, or the One Health committees, they're not clearly represented, as was discussed in the last presentation also. And even if all the actors or stakeholders are there, their activities are not like equally representative. So we really need a One Health approach to tackle AMR. Here I would like to say that AMR is also driven by human behavior. So it has a great social component. We need to have social science research which will tell us what are the main problems, how this human behavior can be tackled, and solution can also be found from social science research. Next slide, please. So now we know that countries have recognized the extent and burden of AMR, and they have developed their national action plan, aligning it very well with the global action plan developed by WHO. Now, for all these countries, WHO technical support was given. There is a template, and that's how it was. The document was prepared by most of the countries, because all these member states, they signed in World Health Assembly that by 2017, they will have this document of National Action Plan. Now, if we look at any National Action Plan, this is just for an example, I have pasted National Action Plan of AMR, but all these National Action Plan, they have many objectives under each specific objective of National Action Plan. And under each objective, there are activities and intervention. And they are not only activities and interventions mentioned, they have also mentioned the time frame, whether this activity be of short term, medium term or long term. Now, these activities I've mentioned, even the stakeholders are mentioned in most of the activities in most of the national action plans. Then there is a section of governance system, and a very nice depiction of multi-stakeholder committees are there. And in many of the national action plan of Southeast Asian countries, for each objective also they have mentioned their multi-sectorial committee, including their chairman, etc. And after that there is a monitoring and evaluation section in this national action plan. Again, it is a very detailed one, that what methodology they will use to monitor and evaluate the particular activity. So in this national action plan or the activities, the one of the important links is that how we can contain AMR by appropriate use of antibiotics or to reduce selection pressure on microbes. And second is to reduce infection rates. So if we reduce selection pressure on microbes and if we reduce infection rate, the net result would be there would be decrease in AMR or there would be reversal of AMR. But now let's see into 2021, where are we? Have countries done some monitoring and evaluation? After say 17, they have prepared their document. So where are we? Have we monitored something? Is there some report available? Next slide, please. So it has been observed that in many countries, the policies have mentioned that M&E section is there. So is true, as I said, for NAP AMR. And it is mentioned that at regular interval or yearly, the M&E will be done. But is that done? No, we are really not aware where exactly each country is, whether the short-term goals have been achieved or not. So what could be the reason? Why M&E is not there when we have a very good document prepared there? Why these activities are either not happening and there is no evaluation? First of all, it is the lack of infrastructure. This is one of the biggest challenge, that there is no infrastructure available to do monitoring and evaluation. And second, most challenging, especially for AMR, is there are various units of government units which are responsible for this activity, but there is no accountability. So if there is no accountability, there is no infrastructure, so generally this M&E is not happening. Now, other thing is, even if auditing is done, even if some monitoring and evaluation is being done, but the reports are not, or we don't see the reports. Why that is so? Because there is a fear of getting blamed for any negative findings. And they are rightly so. There is this scapegoat mechanism that nobody wants to own this negative findings and they want to blame it to somebody else. So this is something very, very important. People should realize that there is a fear of getting blamed. So what is the behavior of all this? That either they don't want to do auditing or they want to delay it. Even if auditing is done, then the reports are not out. So this behavior of just closing your eyes from the real ground situation is one must has to tackle. So what could be the solutions? The solutions could be that we should have a monitoring unit in the nodal agencies with clear TORs that at 6 monthly interval this would be done. And this TOR should mention that they have to report weakness in the system and suggest. So if we have clear-cut TORs with regular intervals, then only something can be done for M&E and evaluation of activity. Next slide, please. Now that was a little bit about governance. Now coming to other part of our discussion today, and I will take one case study. And very briefly, I'll show you that as the poll question is that it is over-the-counter antibiotics are available. So we have done few studies in India, as well as I have data and done some in other Southeast Asian countries, that it has been found that yes, there is a huge amount of antibiotic use and inappropriate use is there. Qualitative studies conducted with various stakeholders clearly show that there is a blame game. Doctors want to blame pharmacists that they give on their own without prescription. They are blaming informal providers. Even they blame government also that why regulations are not implemented. And they also blame customers for overuse, misuse of antibiotics. Pharmacists blame on private doctors having a high fees, so they think they are doing a social just cause or noble cause for poor patients, that they give them antibiotics, and they say that it is not we who are deciding. They copy the prescription of doctors. So whatever doctors are prescribing to poor patients who cannot go to private doctors, we give them this antibiotics. And if we talk to consumers, consumers say it is fault of government that there is poor access of public facility, and we cannot afford at private sector. So we have no choice but to self-medicate ourselves or to take advice of pharmacists. Next slide. And about awareness, when we have done all these studies, it was found that even high school students and teachers, they have poor awareness of antibiotics and AMR. Informal dispensers, which are commonly there at the licensed retail pharmacies in India and other Southeast Asian countries, that they are not aware of AMR, and pharmacists also have poor knowledge. Doctors perceive demand for antibiotics from patients, and they also want to play safe. There is no prescription auditing or antimicrobial consumption at facility level or at any levels. And regulators, if we talk, they say we are short of staff. We cannot do inspection of so many retail pharmacies. And even if we go for inspection, we are more bothered about psychotropic medicine rather than antibiotics. Not much awareness and regulation is there for environmental sector. Lastly, I would like to say, next slide, that yes, we need to do awareness programs, and all of these are mentioned in the NAP AMR. The first objective is about awareness and inclusion of AMR in curriculum. We need to do some qualitative research to find out the behavior and to find out the intervention. I would like to stress here that we need to measure antibiotic consumption. When we say surveillance, surveillance doesn't mean only antibiotic resistance. Surveillance means measuring antibiotic consumption in human animal sector, and also levels of antibiotics in the environment like hospital waste, pharma effluent, soil and water bodies, etc., with a good M&E system. Thank you very much.